Okay, first I'm gonna label the parts here. So we're gonna go for, it's the deltoid. So we're gonna feel for the chromial process. And then go down. And then the axillary crease. And, right, and then this is where the injection will be. Next will be the vastus lateralis. And go right above the knee. Go for the greater the trochanter. Over and then about a third of the way up. And then the injection will be right there. Okay, and then we have the ventral gluteal. I feel for the greater trochanter. Index finger would be toward the spine. Middle finger toward the crest, and then the injection would be right here. Okay, and then next I'm going to wash my hands. I'm going to sanitize my hands first. I'm going to be going into the med room. I'm pulling up the patient's MAR, and I'm making sure that it's the right patient, the right drug, right route, dose, and time. And the medications I'm going to be pulling are insulin, and then I'm also going to be pulling Toradol. And I did take his blood sugar before, and on the based on the sliding scale for his insulin, it was at 245, so he will be getting 5 units of regular insulin. And I'm just checking, making sure that it's not expired or doesn't look cloudy. And I'm going to clean here for 30, I would clean it for 30 seconds. And wait till it's dry.
So I'm gonna take my syringe for
and this is a high dose medication, so I would be having somebody else also make sure that I'm giving the right dose. And first I'm going to pull the 5 milliliter, 5 units. So I'm going to be pulling 5 units of air.
First things first, I'm going to cap it. And I'm going to drop 10 units of air first.
Push that in, and then I'm going to invert it.
And what I'm going to do is I'm going to go inject
And
straight
pull
down.
5 units.
On the C, I'm injecting air into air.
Okay, and I would make sure there are no air bubbles. And then I would label the insulin, and I would label it with the dosage. It's regular insulin of 5 units, and it has the date and time, my initials, and also the patient's name. Okay, next I'm going to get the Toradol. And for Toradol, it's 5 milligrams per milliliter. That's the dose that he needs, but this Toradol here says it's 30 milligrams per milliliter, so I will be doing half milliliter.
I've got the medication, so for
Seconds.
I have the 10 units that I just drew up sub-Q. For the patient, I have his date of birth, my initials, the date and time was drawn. Now, I'm going to go on to drawing up the Toradol. So, simple process, I'm going to take a syringe. In this case, I'm going to draw it up with an 18 gauge.
Okay, so it's a half a liter. So I'm going to pull a half milliliter. So I'm going to pull half milliliter of air.
Perfect. And I already wiped down the bottle, so I don't have to do that again. Uncap it. So, and with the bevel up, I'm going to inject at a bias, a 45-degree bias.
Half a milliliter.
And again, just so I can run out this vibrate so I can put this medication.
And I'd make sure there's no
Again,
air
medication
bubbles.
for Louis Reed. IM injection of 15 milligrams of regular insulin.
And I would throw this into the sharps container.
15 milligrams of ketorolac. And in this case, our vial does read 30 milligrams per milliliter. So in this case, we're going to be injecting half a milliliter
Okay.
to get that 50 milligrams.
And then I would label
Again, I said it's going to be IM.
this Toradol, 15 milligrams per milliliter. I have the patient's name, and then I have the date, time, and my initials.
The time that it says on the
Okay, and now I am leaving the medroom, and I'm going into the patient's room. Okay. Hi, Mr. Reed. My name is Jessica. I'm going to be your nurse today. I have a couple of medications that I'm going to be giving you. First, I'm going to wash my hands.
So in this case, it's going to be half a milliliter. And we're going to be injecting this. Inverted. Drawing up a little bit more.
Okay, and I just want to check your name and date of birth. I'm also going to raise your bed. Name and date of birth, perfect. Okay, first I'm going to give you some insulin. It's for, and I see that you have an allergy to latex, so I'm making sure that I don't have any latex products. The gloves aren't latex, so you don't have any allergy. This is a high-risk medication, so I had a second person check it. This is insulin. I see for you it's 5 units based off of your blood sugar that we took earlier was 245. This shouldn't be given with the pump, and it may cause hypoglycemia. Okay, and first I'm going to, on the side, I'm going to start in the middle, and then work my way out about 2 inches, and then I would let that dry.
And yeah, after checking his chart again and just verifying his allergies and any important information, I'm going to enter the room. Alrighty.
I'm just going to,
Hello, Mr. Reed. How are you doing today?
and we'll put it in at a 45-degree angle.
Perfect. And
And
today I'm going to be, sorry, my name is Jason. I'm the nurse today. I'm going to be giving you your injectable medicines today. Is that alright with you?
And then I would put this in the sharps container here.
Today you're going to be getting
Okay, and the next medication I'm going to be giving you is Toradol for pain, just based off your pain level. And then I'm also making sure that this is the right patient, the right drug, right route, and right dose and time. And I'm going to be giving you 15 milligrams, and it's a half milliliter. And this is for pain. And I'm going to be giving it to you in your deltoid.
7 out of 10. Alrighty.
And with Toradol, you don't want to take it more
I believe you
than
said
5 days.
Allergic to latex, correct?
Okay, and I'm just going to clean the
Perfect.
injection
Alright,
site.
so I made sure that there's no latex in any part of this process.
Okay,
Alright.
and then I would make sure that's dry. Okay.
Alrighty. So yeah. Do you have any questions before we begin? Are you feeling uncomfortable at all?
Perfect.
No, perfect. Alright.
Same.
So
And then I'll check
again,
the
just to
chromial
research,
process
I'm
and go
going to
down.
actually
and be
before we
right
start, I
here,
should say,
and then I would
can I have you say your name
chop
and date of birth,
over
please?
here. Ensure it in a 90-degree angle. Go in and push down, and then pull out, and then let go.
Perfect. Alright, and I can see that it checks out with his
And
wristband
then I
over there.
put this
So.
in the sharps container.
Alright. I'm gonna just double check it tomorrow. I'm gonna check off items again. We're gonna be again Torlac. Insulin is gonna be
I would
2
lower the
units.
bed.
Torlac is in milligrams. This is the right time for the medication.
And give the patient their collie.
Right roots, as we're going to demonstrate, and right patient. Alright, so
Hands.
again,
And then I would go in
time
sharps.
rates again for the third time for the insulin.